edge.
That's cutting edge.
I'm going to brag on your family a little bit because as I'm sitting here with Dr. David Sugarbaker, you have a brother, I think it's Paul.
Yes.
That's down in the D.C. area, and he's also dedicated his professional career to dealing with mesothelioma, but he deals mainly with peritoneal mesotheliomas, as I understand it.
That's right. He is a more of an abdominal surgeon and has taken this on, and we've learned a lot from him and from his research.
Yeah, so you both learned a lot from your dad.
That's exactly right.
One of the interesting things that I know you do at your session with your patients is you bring a survivor of mesothelioma in that you've treated here that has been part of your program, and they talk to the patients and tell them, whatever they may tell them. Will you share some of the concepts, some of the things that those survivors have said about the disease and about fighting the disease?
Well, I would say that when an individual who's been through the surgical treatment, the intraoperative chemotherapy, and whatever other treatments we may recommend after that, when they come in the room, they can transfer more information and more hope in a minute of talking than I can over the course of the hour. Because there's nothing like talking to someone who's been through the process and who can stand there and say, I'm 2 years out, I'm 3 years out, and this is what you're going to face, and it's certainly surmountable, and if you stick with the program and with the coaching, there's a real chance to win. An individual who's been through it, who's standing there telling his or her story, is a very effective way to let people know there is hope, and that certainly it's not hopeless.
Dr. Sugarbaker, in your efforts to promote the patient education, what's one thing that you can just tell